Mental health conditions affect millions of Americans. In fact, according to the National Alliance on Mental Illness, approximately 1 in 5 adults in the United States experiences mental illness each year. Almost 7% of American adults had at least one major depressive episode in the past year, and more than 18% experienced an anxiety disorder. In addition, more than 1% of adults in the United States live with schizophrenia and around 2.6% live with bipolar disorder. In this video, I will show you 5 rare mental disorders that you probably haven't heard of. Number 5. STENDHAL syndrome. Those with STENDHAL syndrome experience physical and emotional anxiety as well as panic attacks, dissociative experiences, confusion and hallucinations when exposed to art. These symptoms are usually triggered by art that is perceived as particularly beautiful or when the individual is exposed to large quantities of art that are concentrated in a single place, such as a museum or gallery. However, individuals may experience similar reactions to beauty in nature. Number 4. APOTEMNOPHILIA. Also known as body integrity identity disorder, apotemnophilia is characterized by the overwhelming desire to amputate healthy parts of body. Though not much is known about it, this disorder is believed to be neurological. Those affected may attempt to amputate their own limbs or damage the limb so that surgical amputation is necessary. Apotemnophilia may be related to right parietal lobe damage in the brain. The condition is challenging to treat because people experiencing it often do not seek treatment. However, both cognitive behavioral therapy and aversion therapies can be attempted in order to treat apotemnophilia once treatment is sought. Number 3. Alien hand syndrome. This syndrome is characterized by the belief that one's hand does not belong to oneself, but that it has its own life. Individuals experiencing alien hand syndrome have normal sensation but feel their hand is autonomous, with a will of its own. Those with alien hand syndrome may personify the limb as a separate entity. The unaffected hand is under the individual's control while the affected hand has its own agenda. This syndrome may occur in individuals who have damage to the corpus callosum, which connects the 2 cerebral hemispheres of the brain. Other causes include stroke and damage to the parietal lobe. The hands then appear to be in intermanual conflict, or ideomotor apraxia, meaning they act in opposition to one another. Number 2. CAPGRAS syndrome. Those with CAPGRAS syndrome hold the delusional belief that someone in their life, usually a spouse, close friend or family member, has been replaced by an imposter. It can occur in patients with schizophrenia, dementia, epilepsy and after traumatic brain injury. Treatment approaches mirror those utilized for the underlying disorders and often include antipsychotic medications. Number 1. Alice in Wonderland syndrome. It is a neurologic condition, in which a patient's sense of body image, space, and/or time is distorted. Those experiencing AIWS may have hallucinations, sensory distortion and an altered sense of velocity. AIWS results from change in perception. Though there are many symptoms, the most prevalent one is altered body image. Patients are confused about the size and shape of parts of their bodies. These symptoms can trigger panic and fear responses.